Studies are suggesting that 1 out of 3 is the average for a dental practice. So in other words, if you get 3 new patient calls, the average dental practice is only converting 33%.
So let's put that in the grade scale. That would be 33%.
Right.
Well, Naren, you heard my grade scale. Where's that fall on the grade scale?
It's a fail. It's an F.
It's a fail.
Yes. And many clients that we started tracking this for, they thought they are doing excellent. Like, I mean, they have had the same team for 10 years, 15 years. And they assumed, this team was excellent 10 years ago. They're probably excellent today. So when we started tracking it, there's one particular example I'm thinking of is a long-time client of ours. Like I have been working with this doctor for like 10 years. And, then he signed up for coaching and together we started tracking this metric. And he was only converting like around 37, 38%.
And this is an exceptional practice in every regard.
Exactly.
Any way you want to measure it, clinical excellence, quality of team members, facility. Man, this office had all of the appearances of literally being a world-class practice. And when you started measuring the call conversion rate, we discovered an aberration there, high 30s, which is a failing grade. And frankly, it shocked me because I would have expected that to be higher.
Exactly. And then we started finding out what was going on. I think, like you said, Gary, data never lies. So because there was no data, like nobody was tracking this, nobody was like literally listening to every single new patient call and saying, okay, this is exactly what your conversion rate is. A lot of the patients who didn't book, they kind of told themselves, I mean, the people answering the phone, oh, they're not good patients. Oh, they asked the wrong question, et cetera, et cetera, et cetera. So they felt they were doing a good job because they were keeping out all the wrong patients out of the practice. But when the doctor started getting this data, as the business owner, he's like, if we just fix this one issue, I'm going to like increase my business by, $500,000.
Well, Naren, let me give you an example. One of the qualities we teach team members is to embrace a spirit of being non-judgmental. It's really a wonderful way to live life, but it also is absolutely a positive quality to have in your dental practice. And so one of the things we experienced in this practice was people would call and ask the question, how much is and then you fill in the blank. How much is a crown? How much is whitening? How much does it cost to have my wisdom teeth extracted? Okay. And there were team members that had, on their own volition, determined that they really didn't want shoppers.
Right.
Now let me try to debrief this a little bit. Naren, you're a shopper.
I think.
I'm a shopper.
Yeah, I mean, we ask questions we know to ask, right? So if the only question we know to ask is how much is this?
Well, stay on shopping for a minute. You're a shopper. If you go to, Starbucks, you're a shopper. You're shopping for a cup of coffee.
Yes, exactly.
If I go into my local Albertsons, a grocery store, I'm a shopper.
Yes,
I'm shopping for my grocery needs and wants, and so. And what you were getting at is what I was going to go to next, is that a lot of times when people call, the only question they know how to ask is how much is something.
Right.
They don't know how to ask, hey, I'm interested in having my anterior teeth restored. What kind of restorative material to use? They don't know how to ask that question.
Right.
How much is a crown?
Right.
And so when we taught that team to run it through a different filter, and the filter was everybody that calls is an appropriate new patient. They immediately pivoted and started to handle it differently, along with some training of what to say. They started handling it completely differently.
Absolutely, Gary. And so there's so one of the questions you asked is, okay, how do we improve call tracking or call conversion rate? Step number 1 is you need to know your call conversion rate. So get a company, we do that for our mutual clients, Gary and I, for Equa and coaching clients. And we literally listen to every single new patient call, and then we figure out what the conversion rate is. So you need to know that metric. That's step number 1. Every single month, you need to know your call conversion rate. Because the minute you start tracking it, one thing we noticed is that every single practice, almost 90% of them, kept improving because now they have something to work towards. Even a practice that was
Peter Drucker, the father of the art of business management. If you don't know Peter Drucker, Google the name. and you'll see that he's recognized as the founder of business management. Peter Drucker said, things that are measured improve.
Improve. It's almost like automatic. So the minute we started measuring it and we started sharing it, 90% of the practices started improving. And some people were already doing 75%, they went to 85%. Some people were doing 35%, they went to 40, 50, 60, 70, then 80%. So in other words, it doesn't matter where you are starting, like almost every single practice started improving. Of course, you need to know your call conversion rate. The other thing you need to know is you need to give some tools for your team so they can improve. So every month we pick 6 calls, 2 calls that are need work, and 4 that are excellent. The reason we pick that ratio is we want more positive reinforcement than negative reinforcement. Even in the positive calls, we say, okay, here are the things you did really, really well. Here are a few things you can improve. The negative calls, same thing. Here are the things you did well. Here are things you can improve. The only thing we asked of these practices is to allocate an hour a month to listen to these 6 calls as a team and talk about it. Like nobody's coaching anybody other than just reading our notes, our comments, but just talk about themselves. Like, hey, now that I'm listening it as an outsider, not necessarily in the moment answering the phone, would I do something differently and why? Have a conversation. So a lot of times our doctors were like quarterbacking it. They were not saying anything. They were just sitting and listening. And the teams were kind of coaching themselves. They were saying, oh yeah, now that I listen to this, I didn't even ask for the person's name. I should have been, maybe something else was going on at that time. And I was like distracted, but I really need to be in the moment.
Pause there, Niren. So Dale Carnegie, in his epic book, How to Win Friends and Influence People, made a point in the book where he said that to many people, the sound of their name is their favorite sound they'll ever hear. Yes. And so a simple technique that any of our listeners can use immediately with your team. When someone calls and they haven't given their name, most of the time the caller doesn't give their name, they can say, oh, by the way, my name is Carly. Who am I speaking with? Linda. Now, so she gave her name, Linda. Now, one more phrase. Now, I'm a fan of having some phrases on your hip pocket, as opposed to scripting. Scripting can be a delicate quagmire. If scripting's not done well, it can sound very mechanical and very canned, and that's not what we want. So I'm not a fan of scripting, but I am a fan of having some phrases on your hip pocket. So my name's Carly. Who am I speaking with? Linda. Now, here's the phrase I want to put on your hip pocket. Linda, it's great to meet you by phone. I can't wait to meet you in person. Now, what does that phrase do? Think of it, dissect that phrase. What have I done with that phrase?
Yeah, so you are welcoming that person. You are like rolling the red carpet. You are saying, I appreciate you as a human being. I love the fact that you called us. I'm so glad I'm meeting you right now over the phone, but hey, I'm looking forward to a relationship.
And I subtly made an assumption. I made an assumption. What was the assumption I made?
The assumption you made is that we like each other? Or?
The assumption is she's coming in. I can't wait to meet you face to face. You missed it, Niren. You missed my subtle assumption.
Yes.
Of course she's going to come in. Why would she ever want to go anywhere else?
Yes, because you're kind of going back to Cialdini's principle around commitment. So it's like you're assuming she's coming in. You're assuming she already said yes by saying, I'll look forward. Yeah.
Great to meet you by phone today. I can't wait to meet you in person.
Right.
So tuck that phrase away and watch how something as subtle as that can make a difference in the way people feel welcomed and the way they feel invited into your practice.